In this brief instructional video, I'm going to talk about how to use the pre-made study maps on the rnstudyguides.com website. Before you watch this video, ensure that you have reviewed the study map list on the website that has a systems approach to all the different types of diseases that you could possibly see on the NCLEX-RN. When you are looking at diseases that you don't know a lot about, these types of pre-made study maps can be a really great resource to help you save your studying time in terms of organizing content and to move you towards really moving through what you understand and what you don't understand about a disease condition. I use these study maps as exactly that, maps. So they are taking the basic information about a disease process, and they're outlining what it looks like in terms of its patho, assessment, diagnosis, pharmacological intervention, and nursing care. These maps are designed to help move you through concepts, to test yourself on what you know regarding the disease and terminology that is associated with the disease and the nursing care. So in a way, they give you a head start in terms of your studying, and they keep you up at an application and critical thinking level while you're moving through the content. So I'll begin by explaining how to use the first stage of these maps in the video. And then the second page of the maps, I'll have a separate video for that posted below this section. So you'll see in step 1, I've listed the pathophysiology and also symptom recognition of the disorder. If there's a video that I find online that I think really helps to, decipher the patho, I usually will link it. And you'll see the video links will come up in blue with a little underline underneath them. If the link isn't working, you will see on the second page of this study guide that the reference will be listed, and there will be a link to the video there. So for example, ARDS is a very complex condition. Many students don't actually get to see this condition clinically unless they're in a critical care area. So you'll see that I have the symptoms of the condition listed, and symptoms are very important for the NCLEX because if you can look at the symptoms and group them, you can often identify the pathology if it's not listed. Symptoms also lead you towards intervention. So for example, if a client is hypoxic or tachypneic, obviously you would be applying oxygen. So they do give you clues, and it's important to know symptoms of disease. I usually will list the pathophysiology, and I'll do that from a very basic level. I don't feel that I need to get into too much depth, but just enough for you to really understand how to link what's happening in the body to the interventions and the drugs that you may choose. In step 2, I ask, what would you assess? And so I list what a client with this condition may present with. So common things like increased respiration rate, increased heart rate, refractory hypoxemia to supplemental O2, so meaning that you give oxygen and they still are not increasing their levels. And then of course other clues around pieces like hypoxia, such as diaphoresis, cyanosis, pallor. I also include key assessments and potential complications because when you're looking at disease processes, you're also looking at how to prevent complications and, of course, most importantly, recognize a complication in care. In step 3, I ask, how would the condition be diagnosed? And I list the common types of tests used for diagnosis. And the reason for this is that the NCLEX-RN in the reduction of risk potential client need area really does go into detail around diagnostic tests. So as you're moving through this, if you don't understand the diagnostic test or you need to look things up, it's really important that you do that. And what I suggest you do with these maps is if there's something you don't know, do write notes and research them and then attach the notes to the back of this map. Step 4 is pharmacological intervention, and you'll see here that I've listed the different drugs in terms of their pharmacological class, and in some instances I've given a prototype drug. So for example, in this map it says inotropic medications and the prototype drug is dopamine. It's important to start studying your drugs with their pharmacological class and really understanding what the pharmacokinetics and dynamics are of that drug class. Because if you can understand receptor function, you will also be able to link it back to pathology and then, of course, into nursing intervention. Step 5 are listed nursing interventions. So what is it that the nurse is going to do with a client with this disease condition? So for example, in this ARDS study map, I talk about oxygen administration to correct hypoxemia. And then if there are any advanced concepts such as mechanical ventilation, I will often list these as well and attempt to explain them to you. As you're moving through the nursing interventions, you may see that I've listed patient teaching or things like positioning strategies that I think are appropriate to the disease. And if you have a complex disease like this one with ARDS, you'll see that I've linked a video below. We have an introduction to ARDS and mechanical ventilation. So the way that you use these maps, their intent is to do the organization of studying for you. So you're not going into your book and just loosely outlining how to treat a disease. The loose outline is completed in this map. Your job is to start by moving through each of the steps and seeing if there's any terminology or things that you don't understand. And if you don't understand something, you look it up. Once you've gone through that initial step of just looking and seeing what you understand and what you don't, then you need to start putting the clinical picture together. So you could talk through the steps with another person or to yourself in the mirror. Talk about how that disease plays out in the body, what you'd find on assessment, what a patient would look like, and then moving through the diagnostic criteria. When you're talking about drugs, start in the pharmacological class and start thinking around what patient teaching would be with those drugs, what you would find in a drug-to-drug interaction, and what complications may be associated in regards to medical therapy. So for example, here you have a patient that's receiving inotropic medications. Inotropic medications, if they go interstitial, when they're given IV, they can cause necrosis. They can also cause the body to shunt blood supply back to the vital organs and can end up causing necrosis on peripheries. So things like that become important pieces because they would come into your patient teaching in your nursing intervention section. And step 5 is really that important area where you're testing yourself around whether or not you understand why nurses do what they do in a disease state. And so in the case of RDS here, oxygen is given to correct hypoxemia. And in these cases, patients are almost always mechanically ventilated because they're so sick. And PEEP, or positive end expiratory pressure, becomes a really important component of management because PEEP helps to recruit, or what recruitment is another term for opening up, collapsed alveoli. And so in nursing, what we do is we work with respiratory therapy and we increase the PEEP in 3 to 5 centimeter water increments until we can get an FiO2 greater than 60%. And then there might be other things listed that are higher level, like high frequency oscillation is used for clients that are very sick with ARDS. It's a type of kind of almost rapid ventilation. And so things that we need to look at are listed here. And then of course in ARDS, sometimes we place patients in prone positions. We use things like lateral rotation therapy or kinetic therapy. So how do you study positioning strategies? For example, with prone positioning, what would be nursing indications with a patient who's laid on their stomach while they're ventilated? So we're thinking about all these things as we move through. So you make notes and you put in the details to these maps, and this is what's going to help you to increase your critical thinking. In the next video, I'll talk about the second page of these maps and how to use them in conversation in order to prepare for the NCLEX-RN.